Hello, doctors. In this module, we are going to discuss about the treatment of heart failure. Before we start treatment, let me understand you the pathophysiology behind heart failure. In simple words, in heart failure, the heart is unable to pump blood, so the blood is not effectively circulating and it will move to peripheral tissues and leads to edema, so body is in fluid overload state. But as heart is not pumping blood effectively, there will be less blood flow to kidneys. The kidneys will start producing renin and activate renin-angiotensin aldosterone system. This will lead to more fluid retention and precipitates fluid overload. So for treatment, you have to know that there are 4 bad factors and 2 good factors. Bad factors are renin, angiotensin, aldosterone, and catecholamines. These factors will worsen heart failure as they will retain more fluid and put more load on heart. On the other hand, there are 2 good factors, named ANP and BNP. These factors will cause natriuresis and help in reducing fluid overload. So, coming to the treatment, we have to give drugs which will be against our 4 bad factors and in favor of our 2 good factors. Let's start with drugs against the 4 bad factors. First one is ACE inhibitor to reduce our bad factor angiotensin 2. Second drug is also against angiotensin 2, that is angiotensin receptor blockers. Our third drug is against our bad factor aldosterone, that is aldosterone antagonist. Fourth drug is beta blockers, that is against our fourth bad factor, catecholamines, such that norepinephrine, done with bad factors. Let's move on to good factors. As you know, AMP and BMP are metabolized by enzymes named neprilysin. So we will give neprilysin inhibitors, but neprilysin inhibitors are used with angiotensin receptor blockers. The reason behind is because neprilysin also metabolize angiotensin too. So if we will inhibit neprilysin, angiotensin will rise and worsens heart failure. So we give neprilysin inhibitors with angiotensin receptor blockers. Now done with good and bad factors related treatments. Let's discuss 2 more types of drugs. As you know, there is fluid overload in heart failure. So we will give thiazides and loop diuretics to remove fluid to prevent load on heart. The second type of drugs are vasodilators, nitrates, and hydrolysines. The reason behind there is nitrates are venodilators, so they will decrease preload, and hydrolysine is arteriodilator that will decrease afterload. In this way, there will be less workload on heart. So these are the main drugs for heart failure. Hope you got clear concepts. If any queries, you can comment below.